alter their lifestyle just because of all these rumours, and of course it would have been quite a good idea if some people had changed their lifestyle.
I honestly don't remember if we told people they should use condoms.
For a long time, Switchboard and Capital Gay were the only places where you could get anything like accurate information, or at least the most up-to-date information, on HIV as it turned out to be. The government, without really very much consultation with us at all, stuck our number on the back of the leaflet that went to every household in the country, along with the iceberg ads on the television about don't die of ignorance. Well, we nearly died of exhaustion because the phone count went through the roof.
The level of media coverage of AIDS, if you remember some of those headlines in the Sun or in the Star in the mid-1980s, it created an environment in which the friendliness, the safety offered by volunteers at Switchboard was really absolutely crucial and vitally important to huge numbers of lesbians and gay men.
It was so much in the press, and it was so much like, it's a gay plague, all these people are dying from it, you know, there's no cure. And when someone goes phoning up saying, I'm HIV positive, it's kind of hard to say, oh, you'll be fine. Because, you know, you pretty much knew that they weren't going to be fine and they were going to die from it.
But we did start to lose volunteers as well, and that was scary too, because people didn't talk about what they had, and people, young men, would start to fade away and die, and the level of stigma was such that they didn't even discuss it usually on Switchboard. It took several years for that sort of taboo to get broken. It was, you just didn't discuss it.
And I think probably working at Switchboard saved my life. I was actually running around like a mad thing in the early 80s, and what I learnt about HIV there made me perhaps take a breath and think about what I was up to.
We decided after a while that because safer sex information wasn't getting through to people, we would bring up the issue of AIDS and HIV in every call, even if the caller hadn't brought it up. And this was controversial both outside and inside Switchboard, but in the end that was a policy that we adopted.
And Switchboard was very involved in that. A lot of our volunteers got used for the first BBC helplines, which then became the National AIDS Helpline. And in fact, there were a lot of rows at that time about whether they were draining our volunteer force, because they were actually paying people to do shifts and we didn't pay people. So we lost quite a lot of good volunteers to that.
I was one of those people, and we all went down to the BBC in West London and watched. There was a little TV at the end of the room where the programme was on, and then this number went up, and I was stunned. I mean, there were probably 100 of us in the room, and 100 phones rang. And then for the rest of the night, calls from the absolutely moving to the absolutely ridiculous.
It was actually the AIDS manual that we had in our reference materials that became the basis for the National AIDS Manual as a general resource.
Not surprising that one of the first services that Terence Higgins Trust offered was a helpline, and it was all volunteer staffed. And all of that knowledge had come directly from Switchboard.
That policy of aiming to give safe sex information in every call is still followed and remains crucially relevant.
I think there's perhaps a kind of a generation of, I don't know if you find this callers, who aren't so clued up about HIV and AIDS and other areas of kind of safe sex, because there isn't kind of the publicity, in-your-face publicity and kind of scary advertising that there were kind of in the mid-80s. So you're kind of getting a new group of people who aren't really that certain about it, and also kind of very kind of number of myths building up. You know, it doesn't matter if I have unsafe sex because, you know, I'll just take some tablets and it'll be fine, which is quite alarming to hear, but we do get calls like that.
And HIV is still the biggest health issue that gay men face in this country. And that's hard to remind people, and it is tough. Almost 20 years, or over 20 years into this epidemic, how we keep doing that day in, day out, and Switchboard still has a central and crucial role in saving lives in that.
But providing safer sex information is only one of the reasons why Switchboard remains so central to the lesbian and gay community.
People are still facing homophobia and harassment. There are huge